HLX22 is an innovative humanized monoclonal antibody targeting human epidermal growth factor receptor 2. Through structural design, HLX22 binds to the extracellular subdomain 4 of HER2, where a new epitope does not overlap with trastuzumab, thus avoiding competitive binding. It is expected to be combined with trastuzumab and chemotherapy for the first-line treatment of HER2-positive advanced gastric gastroesophageal junction cancer. The epidermal growth factor receptor family plays a significant role in the formation and malignant progression of human solid tumors. The EGFR family members can dimerize with each other to form several receptor complexes, thereby activating intracellular signal cascades to regulate tumor growth, proliferation, migration, and survival. Among them, HER2 is overexpressed in up to 23% of gastric cancers, making it an important therapeutic target, especially in advanced gastric cancers. Since HLX22 has a non-overlapping HER2-binding epitope compared with trastuzumab, HLX22 and trastuzumab, when administered together, can simultaneously bind to HER2 dimers on the surface of tumor cells, promoting the internalization and degradation of HER2 dimers. The combination therapy can also trigger ADCC effect, resulting in a strong synergistic effect to inhibit tumor cell proliferation. While facilitating HER2 or HER2 homodimer internalization, the combination therapy can also promote endocytosis of HER2 or EGFR heterodimer, exhibiting higher activity to induce internalization of EGFR protein than the existing therapies. Due to this unique mechanism of action, the dual HER2 blockade therapy effectively increases the internalization of HER2 protein by 40 to 80% and significantly downregulates EGFR protein that is relatively high expressed on the surface of gastric cancer cells, strengthening the blockade of HER2 and EGFR-mediated signaling pathways. This subsequently inhibits tumor cell growth, proliferation, and survival, promoting tumor cell apoptosis and preventing the occurrence of resistance. Furthermore, the combination therapy also exhibits certain ADCC activity, enhancing its anti-tumor efficacy by binding to the Fc receptors on NK cells. Currently, there is no dual HER2 blockade therapy has been approved for the treatment of HER2-positive gastric cancer globally. HLX22 has shown promising efficacy and safety and is expected to combine with trastuzumab to redefine the first-line treatment of gastric cancer. Notably, the dual HER2 blockade therapy of HLX22 and trastuzumab is not limited by patients' PD-L1 expression levels, potentially benefiting the entire patient groups with HER2-positive gastric cancer. In vivo and in vitro studies have shown that HLX22 combined with trastuzumab exhibits significant anti-tumor activity in HER2-positive human gastric cancer cell lines, gastric cancer CDX models, and PDX models, demonstrating superior anti-tumor effects in comparison to existing HER2 dual blockade therapies. The results of a phase 2 study of HLX22 in combination with trastuzumab and chemotherapy for the first-line treatment of HER2-positive advanced gastric or gastroesophageal junction cancer show that the addition of HLX22 to trastuzumab plus chemotherapy as first-line therapy improves efficacy in HER2-positive gastric or gastroesophageal junction cancer patients with manageable safety. The research featured on the cover of Med and presented on ESMO GI. We look forward to further exploring the encouraging efficacy and safety of the dual HER2 blockade therapy in clinical studies, aiming to change the treatment paradigm for HER2-positive gastric cancer and provide more effective treatments for gastric cancer patients.